Hello everyone. Everyone told me MBBS would be difficult, but nobody told me why. Nobody told me this about MBBS. The things I wish someone had told me earlier. If someone had asked me earlier, before joining MBBS, what I thought medical college would be like, my answer would have been very simple, that it is very difficult. That's it. Long books, difficult exams, less sleep, more studying. I thought that was the entire story. And to be fair, everyone tells this. Your relatives, your friends, your seniors, and many people you'll come across will say this one thing, that MBBS is very difficult. Everybody knows this. But nobody actually explains why it is this difficult. What kind of difficult it is. Nobody tells you about the strange habits you develop. Nobody tells you about what you learn, what you gain, and what you lose. Nobody tells you about the things that slowly become normal. So, today I want to talk about the things MBBS never prepared me for. Not the subjects, not the exams, but all the other things. I'll tell you. The things every medical student understands immediately. Let's start with what I consider one of the biggest scams in medical college, rest. Before MBBS, taking breaks meant taking breaks, like watching a movie, going out with friends, sleeping, and that was it. Break means break. But then MBBS happens and everything changes. Suddenly, you're physically resting but mentally exhausted all the time. Now imagine this, it's Sunday, you are resting, you had your breakfast, and then you open your phone and to chill on Netflix, and then suddenly thoughts come. What about that chapter I forgot? Tomorrow there might be Viva in the college, but have I revised the topic of patho? Or did I forget to fill my logbook? And many other thoughts. You ignore it, you keep watching Netflix, but then again, I think I should study. I think that person might be studying, or, let me first complete my logbook and then I'll watch Netflix. Now you are watching Netflix, but you are not relaxed. You're again and again thinking about studying or about completing logbook or some random thing. But you are not relaxing. You're calculating your study hours. The break has become more stressful, which is honestly not an incredible achievement. And I don't know how everyone in MBBS manages to do that, but they somehow keep on juggling between rest and mental exhaustion. And somewhere along the way, I think many of us develop the way of feeling guilty about taking breaks or even for existing. Resting, guilty. Sleeping, guilty. Watching movie, guilty. Going out, guilty. Being happy, guilty. Why? And the funniest part is that even after studying all day, we still feel that we haven't done anything and we are not enough. Like, even if you study long hours, sitting, watching marrow videos or prep videos or cerebral, any videos, and then you feel, oh shit, I should have revised patho instead of biochem, or maybe I should have studied ophtha today, why I chose a difficult subject, or I should have completed my logbook instead of studying, or anything. It just keeps on going on, going on. But in real life, we should learn that taking rest is not guilt, it is your right, and you need to keep your mind relaxed while resting physically. So, whenever you are resting or trying to relax, keep your mind calm and focus on one thing, not juggle between each and everything at once. Or write down those thoughts and maybe later revisit those thoughts. Okay? The other thing that nobody told me was that there would always be someone ahead. I think every medical student has experienced this. We finished studying, we are proud of ourselves, we completed one, two, or maybe three chapters. We feel productive, we feel that today was a good day, we had a great output, and then somebody casually says, "Oh, I revised the entire subject," or "I completed 9 chapters and you are still here." Excuse me, the entire subject or these many chapters? Since when? Then we start thinking again. Why to be in a race? Why decrease your confidence because someone else did so many chapters or did more than you could do in those hours? Comparison in MBBS is really exhausting because it never ends. Someone is solving more questions, someone is reading more subjects, someone is reading good textbooks, or someone has watched all the videos but you haven't. Some people look like they have their life sorted, but it is not like that. Even if that person has finished everything, he or she must be comparing himself or herself to some other person. So this keeps on going on. And I wish someone had told me earlier because I spent so much time believing everyone else had it figured out except me. And the truth is, most of us are just trying our best. We are all confused, we are all stressed, we are all looking at some other person, and we all are pretending to be slightly more organized than we actually are. So, this race keeps on going. It doesn't stop after MBBS, it doesn't stop after MD, it just keeps on going. And not just in medical, but in other fields also, people compare with each other. And this keeps on going, and we need to change it for ourselves, for our own happiness. The third thing which nobody told me about is that the "I know nothing" phase. This one deserves this own chapter, but let's discuss a bit here. This phase is when we have studied for hours. Like once there was a time I was preparing for my fourth year exams. I had my exams in next coming week, and I thought I'm prepared for my exams, but this thought kept on coming in my mind that what if they ask this question, and what if I don't know the answer, what if I forgot, what if I don't remember it in the last moment. And this happens. This can happen to anyone and everyone. It happens when you have studied for hours, days, weeks, months, and your deadline is appearing, and somehow you keep feeling less intelligent than when you started. So, the more you learn, the more you realize how much more is there to learn. And suddenly the confidence keeps on decreasing. And now, if you attempt your MCQs, suppose you get 5 right but just 1 wrong, then you start doubting why I got that wrong. Maybe I didn't revise properly, maybe I didn't study properly, maybe I should have done it that way. But that's wrong. You did your best. You should not question yourself. And if this feelings comes before exams, like it happened with me during fourth year exams, this will become very strong and can impact your exams. So you need to convince yourself that you'll pass, you're good, you know everything, and you can do it. This is for the good also, because I genuinely think medicine teaches humility faster than almost anything else. Because every time you think you are done, you have learned enough, you discover there is another topic to learn, and then another, and keeps on going. So just know that what you have done is enough, and you have done your best, and give everything your best. The fourth thing that nobody told me about was MBBS would slowly become my personality. And I like this thing. This one happened so gradually that I myself also didn't notice. We enter medical college as a complete person. We have our own hobbies, interests, our favorite movies, favorite books, favorite characters, favorite obsessions. But one day you realize every conversation somehow led back to medicine. Someone asks how you're doing. You talk about exams, you talk about your vivas, you talk about how your life is going in internship. When someone asks, what are your plans? It's still about medicine. Which holidays you have, which time you have free, which duty hours you have free. At some point, medicine starts appearing in every conversation. Even sometimes I use these words like when I'm traveling with my mom, dad. Uh, Sometimes I say, like, I'm having dizziness or I feel nauseous. Instead of saying, Mama ulti aa rahi hai, Mama अजीब सा लग रहा है. I don't use these words. I use medical terms instead. And that's one reason I become so attached to writing, because writing reminded me that I was still some person outside of medicine, that there were parts of me that existed before MBBS and beyond the MBBS. And honestly, I think everyone needs something like that. It may be a hobby, maybe some obsession they have, anything. And honestly, something that reminds who they are outside of what they do is the best thing to have. So, yeah, keep on doing whatever you like. Yes, you are a human being first and then a doctor. The fifth thing nobody told me about MBBS was the friendships. But this is where everything gets beautiful, because here MBBS gets a little less difficult and a little more happier. Because in MBBS you meet a lot of people, and some of those people understand things that are impossible to explain to others, like the stress before exams, the panic before vivas, the relief after giving difficult exams, and the last minute revision sessions. They are by your side through thick and thin, and you make the best friendships ever. Now it's been nearly 2 months I completed my MBBS, but I still miss my friends. The random chats we had at 2 a.m. in the night, the random walks in the campus, the shops that were there, especially the ones we had cold coffee from, the ones we had vada pav from. I just miss those days. My life was a little brighter with them, and I really miss them. So some of my favorite memories are not just lectures, D hall, or going and examining a patient and excelling at the diagnosis, but these people I met. We shared our struggle, we shared jokes, we shared feelings. We were the ones who understood each other, and we used to stand by each other through thick and thin. Even when someone used to get ill at night, having cramps in the abdomen, we used to laugh about it and then go to the ER and then laugh there, give vivas to our senior even when we are ill, yet laugh about it. So those were the days we really miss. And unlike other courses where the time period is short, yes, the friendships are stronger. But here, these friendships become family, and you have stayed with them for 5-6 years, and they become a part of you, which you can never forget. So, yes, honestly, I think that's one of the reasons medical friendships become so strong, because we survive everything together. Now, the sixth thing that nobody warned me was that I would change. If I look back at the version of myself when I entered medical college, I think you all will be surprised. Not because I have learned medicine and I changed, but MBBS taught me a lot. MBBS taught me patience, it taught me resilience, it taught me how to keep going even when I felt overwhelmed. It taught me that confidence isn't something I wake up with every day, but yet consistency matters. And confidence doesn't come in one day. We keep on building it slowly, day by day, one day at a time, one diagnosis at a time, and one difficult phase at a time. And one of the biggest lessons that medicine gave me is not just the knowledge, but how to be there for the patients even when you are tired, when you yourself having a lot of struggle in life, but that patient needs you and you are there on just a call, and that smile that you bring to the patient after treating him or her, that is very precious. So, whenever you feel a little low in life or you feel you are struggling, just remember that you are going to change someone's life and make it better for him and his or her family. Yeah. So, yes, MBBS teaches anatomy, physio, patho, biochem, medicine, surgery, and a lot more. But some of the lessons I remember the most are not from textbooks, but the life I lived during MBBS, the pressure I felt, the people I met, the mistakes I did, the growth I have seen in myself, and the moments I thought I could never do it now are the moments I would never love to forget. And I think that's the strange thing about MBBS. Most of the time, we are so focused on where we need to go that we forget to acknowledge where we already are. There's always another exam, there's always another posting, there's always another lecture, another subject, another goal, and another thing to worry about. And because of that, I think many medical students live with this constant feeling that they are behind, that they feel guilty on resting, and they're not doing enough, not studying enough, not productive enough, not smart enough, or not prepared enough. But if I'm being honest here, I have felt this all too. More times than I'd like to admit. There were phases where I genuinely thought everybody else had figured it out, every else was doing the best, and I was at my worst. But when I look back today and I remember everything, I feel that I was not that bad. I also had things figured out. I also did my best in everything. So when time changes, our perception changes. So just remember that wherever you are, whatever you are doing, you're capable of doing it and you're doing your best. And you'll make your dreams come true. And that time shall pass. And remember, everyone is struggling. Everyone has their bad days, everyone has their good days. There is no one who is not struggling, but the ways are different. So just don't compare yourself, do your best, and keep on going. And as I started my video, we all said that MBBS is difficult. But remember, MBBS is not just difficult, not just lengthy, but beautiful, rewarding, meaningful, respectful. And I think sometimes we forget to give ourselves a little credit for surviving everything that once felt impossible and the things we once dreamed for. Think of it. There was a time when even the idea of becoming a doctor, going to a medical college felt so overwhelming. And there was a time in D Hall when anatomy felt impossible. But where are we today? We have completed MBBS, we are doing a lot. And similarly, with many other medical students who are watching this, you are doing great in life and you will overcome this time, and then you'll think that you did great, you were fab, and you are the best doctor. So just keep on going and keep carrying your dreams in your heart and live those dreams. And if someone hasn't said to you yet, I would like to say it, that you're not the only one who is feeling like they're struggling or feeling that why they chose MBBS. I'm with you. I have felt everything. So just keep on going, and I promise everything will turn out for the better and everything will be great. And I hope this channel becomes a place where we don't just talk about medicine, but a place where we talk about our experiences of becoming a doctor, the good parts, the bad parts, the difficult parts, the funny parts, the things nobody says out loud, the things we all feel but rarely talk about. Because MBBS is not just a degree, it's a life, it's a journey of becoming and changing as a person, and I think both deserve attention. So whether you're in first year, final year, intern, or preparing for NEET, PG and INSET, I hope you remember something. You don't have to have everything figured out right now, but everything will work out in the way you want. Just give it some time and consistency. One day at a time, one lecture at a time, one chapter at a time, one small step at a time. And if nobody has told you this recently, I'm genuinely very proud of you. Not because of your marks, your achievements, not because of how productive you have been, but because you're still here. You are still trying, you are doing your best, and that's what matters. And thank you for spending the little part of your day with me. And if you made it all the way here till the end, tell me one thing nobody warned you about in before starting your MBBS and what you felt changed you. I genuinely want to read every single comment, and hopefully, over time, this little corner of the internet becomes a place where medicine feels a little less overwhelming, growth feels a little healthier, and life feels a little lighter. Thank you for being here, and I'll see you in my next video. Bye bye.